So we are blessed when you are in the group, and she's going to teach us today something more in the case. Thank you, ma'am. Welcome.
Thank you, Dr. Doli. Thank you very much.
Welcome, Didi.
We all learn from each other, and see, it is our first gratitude to our master, Dr. Samuel Hahnemann sir, who has, invented this beautiful science, homeopathy, which itself has a lot of power. And then I'm also grateful to our teachers, Dr. Ashok Avadia sir, who has given us such a wonderful platform of this video chat on a Telegram group, Dr. Man sir, Dr. Liaquat sir. We are grateful to all who are helping and who are mediators in sharing and learning of homeopathy. Right? So let us go directly to the case. And so this is the case today that I'm going to share. It is a case of a CA of breast in an 80-year-old widow lady. This case had come to me in the month of June 2021. And this is a case where she has a multicentric neoplasm, but the primary foci is in both the breasts, and the metastases are found in the lymph nodes and the skeletal system. Okay, we'll see her this MRI report. This is the CT scan and the whole body PET scan report. Okay, where you will find that it is given clearly in, if you see the report, if I highlight it, it is given that this is it is a suspected case of carcinoma of right breast. Okay, and the PET scan reveals that there is a hypermetabolic, spiculated and irregular soft tissue mass lesion with adjacent satellite nodules involving the right breast with morphology and the extent as described above is mostly likely suggestive of the multicentric primary neoplasm. And if you see, then there is also, it is suggestive of the multifocal primary neoplasm of left breast also, and suggestive of nodal metastasis which are in the seen in the lymph nodes, left retropectoral lymph node, then also the skeletal metastasis. Okay, so this patient, her daughter called me and she asked me for the Zoom appointment of her mother, and she told me that mother is not able to walk. She's walking with a walker since last 2 to 2.5 years, and it was also the COVID time which was going on, so she took the appointment on a Zoom, and she said that mother is having a 4th stage cancer. And looking at her age and the spread of disease, the even oncologist advised that give her only symptomatic treatment for the pain relief. Nothing else was suggested by the oncologist. So as soon as the Zoom appointment was given, and as soon as the Zoom meet started, before I asked her any question, the patient, she asked me and she started the interview saying, "Bolo." And like, I myself was taken aback, because I had expected 80-year-old patient who is having cancer of breast, and that to 4th stage of cancer. So I had not expected her, the way she came up, it was a bit surprising for me. So then she described her pain. She was very much comfortable when she spoke, and she described her chief complaint, and she said she has a severe pain in her thigh and in the leg, and she's finding it very difficult to walk. And since last 2 to 2.5 years, she's walking with a walker, and she has difficulty in walking, in getting up, in lifting the leg. She was almost like a limping, and she needs someone's help to put her leg even on the bed, or even while turning onto the sides when she's lying on the bed. But then I asked her that, then how do you manage with this leg pain? So she said, nothing, I manage, I walk around, I sometimes apply oil. So I said, okay, then do you have any other complaint? And she complained of pain in the ribs, backache, right hand, axilla. And she said, I have small smelling of cancer. That is why there is a pain in the right axilla. So she again said this very casually. What happens is that when we are dealing with the cases of cancer, either it is like advisable that we should ask the relative when they are calling up whether the patient is aware of the diagnosis or not. because many of the relatives I have seen in the practice that they do not disclose the diagnosis to the patient, thinking that otherwise patient will get emotionally hurt or will feel more tensed and stressed about the diagnosis. But this patient, so I was also not aware whether patient knew or patient knows about her diagnosis or she doesn't know. But here the patient herself said, that I have a small swelling in the right axilla and that is why there is a pain in that. So then that, okay, she knows about it, and she was very casual in telling about this also. She had no difficulty in telling about that. She was describing just as a matter of fact. So there was a difficulty in lifting her hand because of that. The pain is sometimes there, it is not continuous, and I do all my work. I can also make snacks. Now she is coming out by herself that I can make snacks also. I do not have much difficulty. So I asked her, were you stressed when you heard about the cancer? Because she already knew. So she said, no, I am bindas. I wasn't tensed. It happens. I was only tensed that my son shouldn't be troubled. My children shouldn't be tensed. They should be happy. So I asked her, then will you give medicine? No, she only is continuing and asking me, will you give medicine for my leg pain? So I want to move about freely without walker. I go to the kitchen with walker. I keep it aside and I take support of kitchen platform and do everything. So I asked her, so you make your own tea? You can do by your whatever you want, you can do it. So she said, not only tea, I can make snacks, I can make chakli, I can make laddu. I make laddu for my grandson and chakli for my grandson because he likes it very much. And I was so surprised. I'm sure the ladies, doctors, and the other ladies also will know that it is how difficult to make chakli. It is not easy. You usually require two people to make chakli, and it is a very time-consuming job to make proper chaklis. Whereas this patient, she was so happy to say that she can make chaklis and laddus for her grandson, who is 25-year-old, and he is very much attached to the patient. So patient is saying that everyone is worried, that they are not worried about me, they are worried that my grandson, what effect it will have on my grandson about my illness and about if anything happens to me. So otherwise she said, I have no other worries, my all children are fine, everything is fine in my life. So when I asked her, okay, tell me something more about your nature, and she said, everything should happen as per my wish and the way of my working, So somewhere her daughter-in-law who is there, like she is a little hota hai, chalta hai, that type of casual attitude of hers. Whereas the patient who is there, she is very particular about her work. And that is why she wants everything to be particular. She wants even daughter-in-law to do everything very particularly. So she likes her work, she likes doing knitting, and if it has to happen as per her wish, okay, and she wants everything properly. So her stress is, if daughter-in-law does not do it properly, then she will get angry, and only her stress is that it should not, her all the expenses and all the stress of her treatment or everything should not come onto her son, because she felt that the cost of the medicines is too high and they are very expensive. So also she said that her son-in-law is very supportive, and that is why she has a feeling of little relief in that. Then her daughter added, because that daughter was also there on the Zoom meet, so she added that my mother, she's very bindas and she's very courageous. She's very positive and she has a very good willpower. And things don't move her very fast. She won't lose her courage even in the difficult situations. She faces it with good spirit. She won't get weak. She won't cry. And patient was in stress about her son when he didn't have any job, but now he is fine because he is having a job. And also similarly, in the past she was under the stress when husband was unwell. That was from around 2002 to 2009. That was the time daughter said that family had a lot of financial crisis because of the father's illness. His business had closed down, the brother also was out of job, and there was a lot of crisis at that time. But then the patient faced it very well. She used to do hand embroidery and she used to earn money. She managed it very well. She would take care of her father's health. She used to visit the doctors with the husband. She used to look after the house. She only has brought her up her grandson also. Her grandson had one birthmark, a mole type of thing, which was very big and visible, which was there since the birth. So what happened is that this patient, she used to take her grandson from Ghatkopar to Andheri to a homeopathic for the homeopathic treatment, and she patiently did very religiously. She did his treatment till the mole completely disappeared. And after that also, as we saw that she is very attached. She is very loving towards her grandson, and she takes lot of care of him, of his food, and she makes lot of things for him. So with all this, her grandson is very much attached to her, and she loves this grandmother much more than even her mother. So after the patient's husband expired, then the patient's son also got a good job and everything was fine. Then again during COVID or just before COVID, I think the patient's son had lost the job for us for some time, and he had met with some major health problems. So that time again they had some financial issues in the family. But about the cancer, the patient had accepted it very well. And she is otherwise very smart and alert lady, because the daughter described that when she was talking to the oncologist, and when the oncologist was asking her about her bone pains and all, that time also like patient was very alert, and she immediately asked her daughter, what is doctor saying? Is doctor saying that I have a bone cancer? And then patient had to, the daughter had to explain her mother, no, no, don't worry, there is nothing much. Doctor is talking about your leg pains and the bone pains, and he's saying it will be fine soon. Because this patient knew that her sister and her brother, both of them had bone cancer, and her sister had suffered very badly because of the bone cancer. So that was there at the back of the mind of the patient. And another thing is, at the end of the interview, the doctor said that, doctor, we know that it is a fourth stage cancer, but so we are not expecting too much, but we expect that, whatever comfort homeopathy can give, at least we want our mother to be little bit of that comfortable. So we want to try only that. That is what is the limited expectation with which the daughter is coming to us or the relatives are coming to us. Now, we being a physicians also, we know that the fourth stage cancer with a lot of secondaries which has spread to the lymphatic system and the skeletal system, it is definite in an 80-year-old lady. Again, that the age factor also matters. That is going to have a limited prognosis. But what best we can give in the homeopathy, when the oncologist has already said that okay, there is a limitation, and give her only the painkillers, whatever is needed. Otherwise, there is nothing much to be done. That time, what homeopathy can do, that is what I want to share with you, and I want to show in this case. So, if you see the follow up, we started with the treatment. I'll come to the treatment what I gave, but let us see the follow up first. When we started with the treatment, from the first week itself, the patient started feeling better. Okay, and in less than 3 weeks' time, she started turning in bed without pain by herself. Otherwise, earlier she used to literally shout because she had to take the help of somebody, and just to turn also around in the bed, she used to have a lot of difficulty. Then she started taking her leg up on the bed by herself. She started getting up from bed and going to bathroom on her own, and she felt so much better and confident that she could walk on her own without the use of a walker. She just left the walker one day. She within after about 2.5 months, she just left the walker, and she stopped the walker which she was using since last 2.5 years. With her homeopathic treatment of 2 months, she left the walker, and she stopped taking nebulizer. Also, she used to take daily because she was suffering from interstitial lung disease, because she was feeling better even in her lung complaints. So at the end of third month treatment, she expressed her desire to visit to the doctor in the clinic. So she told her daughter that I want to come and see doctor. And she traveled from Ghatkopar to Malad. She came by cab. The daughter-in-law brought her to my clinic, and she came walking without any walker. She came and she entered the clinic very freely. Friends, this is a social media platform, and I cannot share with you the follow-up or the videos of the patients. But it was so wonderful to see the patient, who was under so much of difficulty, and she coming without walker and coming with a very big smile, and the relief that homeopathy could give to her. So when I asked her, okay, you came without the walker, and how are you feeling? And she said, I'm very fine. And when she was asked okay, so um, uh, where is your walker, and she said, no walker, I have left the walker, meaning walker को मैंने बंद करके ऊपर रख दिया, meaning to that extent that she had kept her walker. And I asked her, okay, what happened to your leg, how is your leg? So she's saying कि पग, she's telling me in Gujarati, ये तो सासरे गयो, meaning वो ससुराल गया, अभी इधर है ही नहीं, मतलब मुझे there is no leg pain, वो तो ससुराल चला गया, leg pain अभी मेरे पास है ही नहीं. So she was so happy and confident, and she was so satisfied for her own self also that she's better. Then her daughter-in-law was there, so I asked her daughter-in-law, okay, who is staying with her, what change did you feel? And daughter-in-law also confirmed that there is a big change in her. She's very much fine, and now her speed has increased. She can walk better. And patient said ki are yesterday to I had climbed three floors. I said, why you climbed 4 floors? She said, yeah, I climbed 3 floors without support, without walker. And she also complained of some pain in her hand, where there was a axillary lymph node which is there. And why of that pain? She said, because I have done lot of cooking. Yesterday I had made shira, and I took that shira to 3rd floor. I said, you made shira? She said, yeah, because it was the time when she came to the clinic, it was a Ganesh Chaturthi festival that was going on in India. And during that Ganesh Chaturthi festival, she had made a shira of the Ganpati Prasad for the Ganesh Chaturthi. She had made by herself, lot of it, and she took it by herself on the 3rd floor. So that is how was the follow-up. And it was all of them, like the daughter-in-law, daughter, patient, all of them were very happy and satisfied with the treatment and with the homeopathy, whatever was given. Okay. So now let us understand the analysis and the evaluation of this patient. Okay. So the first rubric that I took for this patient was the high-spirited. A lady who kept her spirits always high in all the odd circumstances of life. She faced it so well without getting scared. She did not get scared even listening about her diagnosis that it was a cancer. She earned the livelihood in all difficult situations. She managed her family very well. Okay, she did not cry over it, but she faced it, and that she faced by making her spirits, elevating her spirits, and that was high spiritedness. The second rubric that I took was a buoyancy. She has capacity to lift herself up, float herself. What is buoyancy? When there is something which is under the water, then to like it is pressing itself up. The pressure it can push, with the pressure which it is giving to its own self, it can lift and it can float. The buoyancy is the capacity to lift herself up, to float. Even after knowing her diagnosis, her siblings had cancer, still she is able to come to terms in life and is not only able to do all her work but also make chakli and laddus for her grandson and for the prasad. She says, I am absolutely fine and nothing is happening to me. She is not anxious about her illness, and her concern is her family, her children. Her children shouldn't suffer the grief because of her. How will my children manage finances? She keeps telling daughter daily, you don't take this tension. This is her anxiety, children about. And her concern is her children, and they shouldn't suffer the grief. Okay. So what she does is she prepares the food for grandson, and she has takes all the care for him. Okay, and that is why he is so much attached to her, much more than uh, uh, her mother. Sorry, his mother. Meaning, he is attached to grandmother so much. So this is her cares full of, and she really takes a lot of care. In her follow up, she said that she had a little pain in the breast and a little serious discharge in the blood, which was coming up from her breast. But what happened is that so when she got that discharge, she called her daughter and told her that, okay, today I am having little pain and the discharge, because she had done lot of exertion, made all that shira and lot of things, with her hand. So next day she was better. So as soon as she was better, she again called her daughter and said that, no, you don't worry about me, I'm really better, and I'm meaning completely better. Today I have no pain of this and no difficulty. Okay. Then also she was alert. She had asked us, that which medicine you will give. Will you give me medicine for my leg also? Because what she wanted is she wanted a freedom from that walker and she wanted to walk freely. Okay. Then uh, also she has aggravation from the contradiction that things must happen as per her wish only. Otherwise, she would get angry at the daughter-in-law. Okay, then she's also very positive and she handles everything very positively. She wants everything in kitchen very clean and particular, and she's perfectionist and she wants things everything in its place. That is fastidiousness. She has done hand embroidery and she has managed the household finances through her art, and that is her art ability for in the difficult times. Also, then she has a strong factor of taking up responsibility too seriously, which was very well seen during her husband's illnesses, the way she visited doctors and the way she took care of her husband and the family's financial conditions also at that time. Okay, so few more rubrics to this are: courageous, affectionate, love for family, order, desire for, vivacious, and attached strongly to others. See, the love for family is very, very evidently known in this case. Okay, she was doing all this. She was full of care. She was anxious about her children. But what all this thing was finally for? Because of her love for her family. So when we repertorize all these rubrics, remedy which is coming up is carcinosin. So she was given carcinosin 200 in a plussing method. So that is a diluted water method that I give carcinosin, because see, the cancer is a pathology in which the multiplication of the cells is very fast, and because of that, when we want to stop that multiplication, we want to restrict that multiplications. Our force also, the remedial force also has to have a stronger force and the stronger repetitions. That is why you need to repeat it very frequently, and to repeat it very frequently but safely is better to give it in a water diluted doses in a plussing method. That is why carcinosin 200 was given in a plussing method. And you all know the follow up that I told, that within 2 months of treatment she left the walker, and just even before she completes the third month she came, leaving her walker from Ghatkopar to Malad. And then she, after that, she completely lived her life without walker, very freely and very happily, in a satisfied way. Okay, so we know the carcinosin. This patient was a complete book picture of carcinosin. And many of the doctors, who, if you see the history and all, you will be able to understand it. My objective of presenting this case today was completely like, that we as a homeopath should not restrict ourselves just with the name of the diagnosis of the disease. We should not get scared with that okay, what can we do when the oncologist is saying there is a limited help that they can give? What we as a homeopath can do? And if we ourselves refuse the patient that no, we cannot help, we should not do that. We should take the case in our hand. We should try to take the case make the best of the totality, understand the patient's characteristics very well, whatever things which are uncommon, which are characteristic in the case, give importance to it, and make a best of the totality and come to a remedy and give that remedy. The first word itself of this patient, when I started with the case and the way she said bolo, I was so taken aback, but that itself was the first characteristic that came to my mind. Okay, what you are expecting from the patient and what you are getting is something different. So this is very characteristic. And from that, what came up was the high spiritedness and the buoyancy of the patient. Okay, so these are the rubrics which I think we all know about the carcinosin case, that all these are the positive rubrics of the carcinosin, which I am sharing in the PPT. I think I'm not going through all that. We all know about it. Still, just for the sake of references, I am putting it up. Okay, thank you very much. Thank you, Dr. Vadya sir. Thank you, HSH, for giving this wonderful platform. Thank you.
शोभा मैडम, मुझे प्लसिंग मेथड थोड़ा सा समझा दीजिए.
Sir, plussing method is the method which I have learned from Dr. Ramakrishnan, who is from the south. He has written a book with cancer and homeopathy, and what he is saying about this method is you dissolve one powder of this medicine or few pills of the globules of the medicine into 11 spoons of water. Okay, sir. So this is dissolve few globules into the 11 spoons of water. Out of that, take one spoon every 15 minutes.
जी.
So first 10 spoons है वो every 15 minutes लेना है. Last spoon of that medicated water you have to preserve that. So this will take around 2.5 hours of time. So ये 2.5 hours में we tell patients that they can have water or they can have liquid, but not to eat anything. And they should take this one spoon every 15 minutes. Last spoon which they have preserved, next day they will dissolve this one spoon again into another 10 spoons of water and make it 11 spoons. So again it is further diluted. Again take one spoons every 15 minutes, take 10 doses, preserve the last dose. Again on the third day again dissolve that into 1 spoon of water. Similarly, I go on for about 1 week. After 1 week, either in cancer cases, I do give some cancer nosodes if needed. In this case, it was not needed because it was matching with the carcinosin itself. Or if they need any other remedy needs to be given, that organ remedy needs to be given, that I give. If not, then the fresh dose of the another medicine to be given on the next week. Again, that is to be started with the plussing method in the same way.
बीच में यदि पेशेंट को रिलीफ लगने लगता है तो हमें रोकना है या लगातार 10 डेज या 7 डेज?
नहीं सर, नहीं रोकते हैं पेशेंट को. देखो पहले वीक में ही स्टार्ट इम्प्रूवमेंट होने लगा, बट सर वी हैव टू गो फॉर अ लॉन्ग वे बिकॉज द वे आई सेड कि कैंसर सेल्स मल्टीप्लिकेशन बहुत फास्ट होता है एंड इम्प्रूवमेंट भी हमको चाहिए, वो काफी हद तक चाहिए होता है. देयर इज अ लॉट ऑफ पैथोलॉजी ऑलरेडी है, तो वो मेटास्टेसिस इतना है बॉडी में. दैट इज हाउ आई डू. आई एम नॉट श्योर अबाउट, बट दैट इज हाउ आई गो अहेड.
जी, ओके.
मैम फिर रिपीटेशन कब होगा? ये आपने पूरा दे दिया एक वीक के लिए जो आप बोल रहे हो.
हाँ, तो नेक्स्ट वीक में मैं वापस अनदर पाउडर ऑफ कार्सिनोसिन देती हूँ टू बी डिसॉल्व्ड एंड कंटिन्यूड इन द सेम वे. तो बिकॉज 200 से ही उनको इम्प्रूवमेंट था, तो आई कंटिन्यूड विद 200 ओनली फॉर फ्यू वीक्स और फ्यू मंथ्स टिल शी इज बेटर. बट एवरी वीकली उनको एक अलग पाउडर को डिसॉल्व करना है.
बेटर मतलब फिर कब तक हम व्हाट विल डिसाइड व्हेन टू स्टॉप दैट प्लसिंग मेथड की हाउ इट विल बी?
नहीं, वो उसी तरह से होगा कि हाँ, हम वेरी गुड क्वेश्चन. प्लसिंग मेथड कभी हम स्टॉप करेंगे जब भी हमको, मुझे ये पेशेंट में जब भी वो वॉक करने लगी, उसने जब भी वॉकर छोड़ दिया, उसके बाद मैंने उसको प्लसिंग मेथड बंद करके उसको वीकली डोज पे आ गई. मतलब मैं
वो जानना चाहिए कितना दिन देना है.
यस. सो दैट विल डिपेंड ऑन एवरी पेशेंट कि उनकी पैथोलॉजी कितने एक्सटेंट की है, व्हाट लेवल ऑफ इम्प्रूवमेंट वी एज अ फिजिशियन, वी एज अ होम्योपैथ्स आर एक्सपेक्टिंग. बिकॉज
अच्छा।
हमारा भी हर एक केस के साथ में कुछ अपना एक्सपेक्टेशन रहेगा कि ओके हम क्या एक्सपेक्ट कर रहे हैं ये पेशेंट में, कितने लेवल का इम्प्रूवमेंट एक्सपेक्ट कर रहे हैं.
ओके मैम.
ओके ओके.
Yeah, mainly for cancer only. I am not using for anything else. And what I learned from Dr. Ramakrishnan also, he also, as far as my knowledge goes, and when I had read him, he was also using it for the cancer only.
Okay, ma'am. Thank you.
Other cases, other deeper pathology cases, we do give in the water diluted doses, maybe in the BD or TDS doses.
Yes.
थैंक
मैं
यू.
एक बात बोलूं अशोक भैया?
दो बात बोलो.
शोभा मैम, आपका नाम शोभा है ना, तो ये ग्रुप की आप शोभा हो.
अरे अरे थैंक यू सो मच यार, थैंक यू सो मच. आप लोगों का प्यार ही बहुत कुछ है. ये केस बहुत सिंपल था. इट वाज अ कंप्लीट बुक पिक्चर ऑफ कार्सिनोसिस. स्टिल आई जस्ट वांटेड टू प्रेजेंट इट. द ऑब्जेक्टिव बिहाइंड प्रेजेंटिंग दिस, उसका वीडियो अगर आपने वो पेशेंट का केस टेकिंग और फॉलोअप का देखा तो वो इतना ब्यूटीफुल वीडियो है.
थैंक यू मैम, यू लर्न मेनी थिंग्स फ्रॉम यू. और आज देख के प्लसिंग मेथड भी बहुत अच्छी बात है, हमको कुछ सीखने को मिला.
थैंक यू वेरी मच ऑल ऑफ यू.
थैंक यू.
Yes, thank you sir.
Thank you, ma'am. Your cases always give confidence, ma'am.
Thank you very much. Thank you Dolly, thank you Vaishali, thank you Mansi, thank you Ashok sir.
थैंक यू दीदी.
You are doing a wonderful job you are doing.
इसी सीखना है ना मुझे, मेरा मतलब
Sir.
है स्वार्थ.
Yes sir, but फिर भी keeping everyone मतलब on the toes and सबके पास से करवा के लेना बहुत डिफिकल्ट है सर.
बस आप जैसे लोग अच्छे लोग मिलते जाए तो सबको सीखने को मिलेगा.
Yes sir, yes sir.